Welcome to the We Level Up Treatment Center video series. In today's video we will discuss non-addictive anti-anxiety medications. What are non-addictive anti-anxiety medications? Alcohol and drug abuse is common among those with an anxiety disorder because individuals often use alcohol or drugs to cope with anxiety symptoms. In this situation, addiction and anxiety would be classified as co-occurring disorders, wherein both issues develop together and worsen each other. This article lists non-addictive anti-anxiety medications and treatments in non-habit-forming anxiety medication plus non-medication alternatives. Without proper treatment, prescribing addictive benzodiazepines for anxiety could worsen addiction issues. That's why our dual diagnosis program works with each individual to find the right prescription for them, even if that's a benzo alternative. Medication management is an essential part of treatment for many people. If you have anxiety and a history of addiction, we'll work with you to find the right option for benzodiazepines for anxiety. Common anxiety signs and symptoms: feeling tense, restless, or nervous, having a sense of impending doom, danger, or panic, having an increased heart rate, breathing rapidly or hyperventilation, trembling, sweating, feeling tired or weak, trouble concentrating or thinking about anything other than the present worry, having difficulty sleeping, experiencing gastrointestinal (GI) problems, having trouble controlling worry, having the urge to avoid things that trigger anxiety, symptoms of substance dependence syndrome, the increased dosage needed over time to achieve the desired outcome, diminishing effect over time despite unchanged dosage, withdrawal syndrome on discontinuation, continued drug use to prevent or avoid withdrawal, dosage larger or duration of use longer than intended, inability to reduce or control drug use, excessive drug-seeking behavior, social, recreational, or occupational activities given up or destroyed due to drug use, continued drug use despite knowledge of damaging physical or psychological consequences. Top 6 non-addictive anti-anxiety medications. SSRI drugs, or selective serotonin reuptake inhibitors drugs, for anxiety. What are SSRI drugs? What are SSRI side effects? SSRI versus SNRI comparison. This class of medication is one of the most commonly prescribed in anxiety disorder treatment. This medication increases the amount of serotonin in the brain. It aims to improve mental health by binding to neurotransmitter receptors in the brain, ultimately reducing stress and improving mood. SNRI drugs, or serotonin and norepinephrine reuptake drugs, for anxiety. What are SNRI drugs? What are SNRI side effects? This class of medication has been proven effective in treating the symptoms of panic disorders and generalized anxiety disorder, GAD. Not only does this type of medication helps regulate serotonin release, but it also helps release norepinephrine. Norepinephrine is a brain chemical that affects concentration. Buspirone for anxiety. What is buspirone? Is buspirone addictive? What are buspirone side effects? What is a typical buspirone dosage? Buspirone is a non-addictive and non-narcotic medication that works similarly to an SSRI. Buspirone only affects one serotonin receptor subtype within the brain, leading to fewer side effects. Buspirone is an ideal medication for those struggling with mild to moderate anxiety. Buspirone medication is available under the brand name Buspar. Buspirone is a slow-acting substance. Buspirone acclimation can take up to 6 weeks to feel its effects but has a lower risk for dependence. Hydroxyzine for anxiety. What is hydroxyzine? What are hydroxyzine side effects? What is a typical hydroxyzine dosage? What is hydroxyzine used for? This non-narcotic prescription blocks histamine receptors within the brain, ultimately elevating mood and acting as a low-grade sedative. Hydroxyzine is an antihistamine that helps fight allergies. However, it can also be legally prescribed to treat symptoms of anxiety. It is a fast-acting medicine, making it more effective in the short term than buspirone. Beta blockers for anxiety. What do beta blockers do? What are beta blockers' side effects? How do beta blockers work? Are beta blockers safe? Beta blockers medications work to give temporary relief in the case of anxiety-related episodes, such as panic attacks. Beta blockers do not change brain chemistry. Therefore, they are not prescribed long-term. Beta blockers are non-addictive and a typical choice for those who need instant relief from intense symptoms. Gabapentin for anxiety, Neurontin. What is gabapentin? What are gabapentin's side effects? What is a typical gabapentin dosage? What is gabapentin used for? Gabapentin is commonly prescribed for seizures and nerve pain. While gabapentin is considered an off-label use, treatment of anxiety conditions with gabapentin has seen promising results from initial studies and case reports. Gabapentin's FDA label does not list anxiety as a medical condition it treats. However, gabapentin may still be prescribed for anxiety by a psychiatrist. It is available as the prescription Neurontin. Non-addictive anxiety holistic treatment options. Cognitive behavioral therapy for anxiety, CBT for anxiety. CBT helps people to rewrite the stories they tell themselves about their lives. The mind is a great tool. Thoughts can spiral us into worse fear, anxiety, and anger. Or, in reverse, it helps raises us to a more calm state. Controlling the perspectives and stories we repeat can significantly help relieve our anxiety. CBT enables clients and therapists to work together in a therapeutic relationship to identify destructive and unhealthy thought patterns and actively explore alternate thinking. The skills individuals learn through cognitive behavioral approaches continue after the completion of treatment. Dialectical behavioral therapy for anxiety, DBT for anxiety. DBT is a form of CBT that centers on 4 key tools. Mindfulness focuses on improving an individual's ability to accept and be present in the current moment. Distress tolerance is geared toward increasing a person's tolerance of negative emotion rather than trying to escape it. Emotion regulation is strategies to manage and change intense emotions causing problems in a person's life. Interpersonal effectiveness involves learning techniques to communicate with others assertively, maintain self-respect, and strengthens relationships. At-home options for anxiety without non-addictive anti-anxiety medications. Non-addictive anti-anxiety medication isn't the sole option for treating anxiety. These methods have been demonstrated to work equally, if not better, for some people than non-addictive anti-anxiety medication. You can either learn them on your own or receive instruction in treatment. If you understand how to use them, you can lessen worry if you ever need to stop taking your prescriptions or switch them. When you're feeling worried, try some of the following to relax. Follow a guided meditation routine. Write in a journal about your anxiety, doing your best to describe it. Do this each time you confront a fear, and note any changes over time. Stream your favorite movies and/or TV shows. Make a mental note of something you can see, hear, smell, taste, and touch. This grounding approach can help you connect with your environment and divert your attention from your worry. Try breathing in squares. Take a 5-second breath in, followed by a 5-second hold. Take a 5-second to exhale, followed by a 5-second pause. Repeat until you notice a slowing in your pulse rate and an end to your shaking. Anxiety treatment. Support group. A place where those pursuing the same disease or objective, such as weight loss or depression, can receive counseling and exchange experiences. Cognitive behavioral therapy. A conversation treatment that aims to change the negative attitudes, actions, and feelings connected to psychiatric discomfort. Counseling psychology. A subfield of psychology that handles issues with the self that are connected to work, school, family, and social life. Anger management. To reduce destructive emotional outbursts, practice mindfulness, coping skills, and trigger avoidance. Psychoeducation. Mental health education that also helps individuals feel supported, validated, and empowered. Family therapy. Psychological counseling that improves family communication and conflict resolution. If you or someone you love is struggling with an anxiety disorder or other mental health issues, get them the help they deserve. We Level Up Florida provides options for non-addictive anxiety medications as part of our holistic treatment program. Contact our team today. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.